Unit 1 Fundamentals Questions 1. Helen agrees to talk to the HIV/AIDS nurse after recommending another blood test which is positive. The nurse justifies her action by referring to which of the standard of practice? 1. Standard 1, 2. Standard 2, 3. Standard 3, 4. Standard 7. Answer 1. Standard 1. 2. Helen is offered the opportunity to participate in research new therapy. The researcher asks the nurse to obtain Helen's consent. What is the most appropriate action for the nurse to take? 1. Be sure Helen understands the project before the sign the consent form. 2. Read the consent form to Helen and give her an opportunity to ask questions. 3. Refuse to be the one to obtain Helen's consent. 4. Given the form to Helen and tell her to read it carefully before she signed it. Answer 3. Refuse to be the one obtain Helen's consent. 3. A nurse is caring for a hospitalized client with a diagnosis of abruptoplacenta. The nurse develops a nursing care plan, subject measure to be implemented in the event of the development of shock. The nurse documents that the initial nursing action in the event of shock in which of the following? 1. Turn the client on her side. 2. Check the client blood pressure. 3. Monitor urinary output. 4. Check the client's heart rate. Answer 1. Turn the client on her side. 4. A nurse is assigned to care for a pregnant client with a diagnosis of sickle cell anemia. The nurse reviews the plan of care and notes documentation of 4 nursing diagnoses. Which diagnosis would the nurse select as the priority? 1. Activity intolerance. 2. Ineffective coping. 3. Imbalanced nutrition less than body requirements. 4. Deficient fluid volume. Answer 4. Deficient fluid volume. 5. A hospital nurse recently attended a conference on a new method of documenting client data and wants to implement the new method of documenting in the nursing unit in which is she employed. The nurse should do which of the following to be effective facilitating change? 1. Inform the nursing supervisor that current method of documenting client data must be changed and the request that all staff required to complete. 2. Write a new documentation policy over the weekend and distribute it co-worker for immediate implementation on Monday. 3. Ask co-worker help gather data comparing the hospital documenting procedure with those of the other local healthcare facility. 4. Point out co-worker the various mistakes they are presently making in the current method of documenting. 5. C. Ask co-worker to help gather data comparing the hospital documenting procedure with those of the other healthcare facilities. 6. A nurse administers a fatal dose of cardiac medication to a client. During the subsequent investigation, it was determined that the nurse did not check the client's vital signs before administering the medication. This failure to complete an appropriate assessment is addressed under which functions of the Nurse Practice Act? 1. Defining the specific educational requirement of licensure. 2. Disturbing the scope of practice licensed and unlicensed care provider. 3. Recommending disciplinary action for nurse who violate the law. 4. Identifying the process for disciplinary action if standard of care are not met. Answer 4. Identifying the process of disciplinary action if standard of care are not met.